Hi, welcome to Heart Month. My name is Teresa Dark. I'm from Henry Ford Allegiance Marketing and Communications. And today I have with me Henry Ford Allegiance vascular surgeon, Zachary Burgin. Welcome.
Thank you. Nice to meet you.
Today we're going to talk about what you do for the community and for Allegiance. So can you give us a little bit about yourself?
Sure. I'm a vascular surgeon. I just joined the practice here in September, and I work mostly on disease of the arteries and the veins.
And blood clots. I hear a lot of people talk about blood clots. Can you explain what that is and how that affects us?
Yeah, so to kind of go back to my old previous analogy, think of the heart as a pump. Arteries push blood away from your heart down your fingers and your toes, and then veins are the vessels that carry blood back up to your heart again. Usually when someone's talking about a blood clot, it usually means in the veins, so the venous system. We give it a name, a deep venous thrombosis, meaning a deep vein with a clot. That's what thrombosis means. So you can have a clot that develops in your leg, whether it's from trauma, being prone to blood clots, or some other reason, and we get worried about that because of two problems. One, it can cause problems with the venous system, where you have swelling in your legs and pain in your legs all the time. Or two, that blood clot can actually travel to the heart. And that's what we call a pulmonary embolus, or a PE. When someone says they have a blood clot in their lungs, that's usually what they mean. And usually we try to find patients before that happens. And generally we treat that with blood thinners like warfarin or heparin in the hospital.
So how does somebody know if they have a blood clot? Are there any signs and symptoms that they can look for?
Yep. So usually when somebody has a first blood clot, most of the time folks that have blood clots have had them before. They would be the highest risk. Beyond that, somebody having a new blood clot, they'll say, my leg, usually only one leg, is painful and it's really swollen. It's twice the size of my other leg. And oftentimes they'll get sent to the emergency room and we'll do an ultrasound and we'll find a blood clot in their leg. Depending on where it is, we may need to do a procedure to remove that clot.
So what are some things that we can do differently in our lifestyle so that we don't get blood clots, or we can just live healthier so that may not happen to us?
So there aren't a lot of modifiable risk factors for these blood clots other than living sedentary lifestyles. So folks that are spending all day, every day on the couch, things like that, they might be more likely to develop a blood clot than somebody who's active, walking, running all the time.
So activity will help. And is there anything in our diet that we would do differently, or is it just being active and exercising and just walking?
So activity would probably be the only modifiable thing for most folks. Beyond that, there's not necessarily something diet related, but most of the time it's related to that or some other risk factors.
So if we just out there walking, it doesn't even matter how far, that can help us stay healthy. Thank you, Dr. Burgin. We appreciate it.
No, you're welcome. Thanks.